Hello, my name is Audra Kessler and I am a doc student at Pennsylvania Western University. This is my Scholarship Artifact 1 presentation from my evidence-based doctoral portfolio. This presentation focuses on enhancing medical education to reduce healthcare disparities among special populations of patients. Special populations of patients encounter significant challenges in accessing healthcare. These vulnerable groups include individuals who are deaf or hard of hearing, members of the LGBTQIA+ community, survivors of intimate partner violence, people experiencing homelessness, and victims of human trafficking. Healthcare providers have an ethical responsibility to deliver equitable, high-quality care to these patients. However, numerous barriers continue to hinder the delivery of optimal care. To address these challenges, providers must be equipped with the knowledge, cultural competence, and clinical skills necessary to meet the unique needs of these populations. Homeless patients face healthcare inequities due to their unstable living conditions and limited access to healthcare. In 2018, approximately 500,000 people in the United States were homeless. To address these disparities, the practice of street medicine was developed, enabling providers to deliver care to homeless individuals in areas such as sidewalks, park benches, or under bridges. Educators have begun integrating the care of homeless populations into medical training programs. However, the topic often remains optional within most curricula. A study by Feldman et al. 2020 demonstrated that exposure to homeless patients and educational content enhanced student learning. Victims of intimate partner violence experience many physical and psychological health consequences. These patients often require frequent medical care. For example, on a single day in 2018, more than 75,000 victims of intimate partner violence access healthcare services. Research has identified a significant gap in medical curricula and continuing education regarding intimate partner violence. A study by Smith et al. 2022 found that only 48.6% of physician assistants reported receiving education or formal training related to intimate partner violence. Human trafficking is a form of modern slavery that includes forced labor, bonded labor, child exploitation, and sexual servitude. Victims frequently endure serious health consequences. These conditions often necessitate healthcare intervention, placing medical professionals in a critical position to be able to identify and support victims. Despite this, limited training prevents many providers from recognizing the signs of trafficking. A study by Lederer and Wetzel found that 87.8% of female sex trafficking survivors sought healthcare while in captivity. This highlights an urgent need for education on victim-centered, trauma-informed practices. Recent initiatives, such as a pilot study by Doss et al. That integrated trafficking education through viral lectures and standardized patient scenarios, have demonstrated significant improvements in student knowledge and represent a promising strategy for the healthcare curricula. This community experiences healthcare disparities, particularly in the domain of sexual and reproductive health, as a result of stigma and discrimination by providers. These patients receive insufficient information regarding women's health while also experiencing lower vaccination rates, reduced preventative screening, and higher rates of reproductive cancers. A lack of provider knowledge and confidence further exacerbates these disparities. Carroll et al. 2023 found that medical students reported lower confidence when caring for LGBTQIA+ patients compared to the general population. Only 10% felt they received adequate formal training, while 65.2% reported that learning came from primarily outside of the medical curriculum. Educational interventions in knowledge, attitudes, and communication skills have shown promise in reducing these healthcare disparities. Integrating LGBTQIA+ health into medical and nursing curricula helps to better prepare future providers, reduce disparities, and advance health equity for this population. The World Health Organization estimates that approximately 460 million people worldwide are considered deaf. Individuals who are deaf or hard of hearing face significant healthcare disparities, especially surrounding communication. For example, Hamas et al. 2018 found that interpreters observed medication misunderstandings in nearly 50% of appointments in these patients. Healthcare providers play a critical role in managing these patients, but still face communication challenges such as limited sign language proficiency, inadequate access to interpreters, infrequent encounters with deaf patients, and insufficient knowledge of the American with Disabilities Act. Strategies to improve care for this patient population include incorporating sign language into healthcare interactions, adapting clinical tools, expanding provider training, developing accessible facilities, utilizing online interventions, and creating educational programs and videos. This presentation highlighted health disparities experienced by vulnerable populations and their impact on health. Many studies demonstrate the positive influence of education and training on healthcare providers' ability to care for marginalized groups. Further research is needed to identify, implement, and evaluate educational interventions within the higher medical education to advance health equity for these populations. Medical providers play a critical role in addressing healthcare inequities. Without education and training, providers may lack the knowledge, confidence, and skills necessary to deliver effective patient-centered care. Incorporating structured education on the care of special populations into the medical curricula is crucial for enhancing provider confidence, enhancing clinical practice, and advancing health equity. Thank you for viewing my presentation on enhancing medical education to reduce healthcare disparities among special populations. Listed here are the references I used throughout my presentation.